The open enrollment period on healthcare.gov to purchase health insurance for 2021 has closed. This is a very short window. People were able to shop to get coverage, the annual open enrollment period. If you missed it, most people will have to wait until the next open enrollment period in the fall of 2021 to purchase health insurance coverage. The exception is if you have a qualifying life event. In fact, if anybody in your household experiences a qualifying life event, you can be eligible for what's called a special enrollment period, an opportunity to go back into the marketplace and pick a new health insurance plan. There are a number of qualifying life events that could trigger a special enrollment period. They come in the form of changing household size, changing income, maybe you've moved. We're going to talk through a couple examples today. The first one is common, it's getting married. If you pick a plan by the last day of the month, your coverage can start the first day of the very next month. If you got divorced or legally separated and lost health insurance because of it, you qualify for a special enrollment period. The divorce or legal separation alone does not trigger a special enrollment period. The consequence of that action is that you lost access to health insurance coverage. Then you qualify for a special enrollment period. If you had a baby, you adopted a child, or had a child placed from foster care, that qualifies you for a special enrollment period. The effective date is actually the day of the event. Coverage can start the day the baby is born. For example, let's say someone on your Marketplace plan has died. As a result, you're no longer eligible for your current health plan. That action makes you eligible for a special enrollment period. Let's say somebody has moved. There are types of moves that qualify people for a special enrollment period. You move to a new home in a new zip code or a new county, that qualifies you for a special enrollment period. You move into the United States from a foreign country or a U.S. territory. If you're a student, you move to or from the place you're attending school. If you're a seasonal worker, moving to or from the place where you both live and work, or you move to or from a shelter or transitional housing. All of those types of moves qualify you for a special enrollment period. There are a couple notes on moving, however. You must prove that you had qualifying health coverage for at least one day in the prior 60 days before that move. So some proof of prior insurance, even if it was only for one day before the move, then allows you to purchase new health insurance coverage. If you were completely uninsured before the move, for 60 days before the move, this is not going to trigger a special enrollment period. This rule about having access to insurance and having proof of it for at least one day in the prior 60 days does not apply to individuals who are moving from a foreign country or a U.S. territory into the United States. That's the exception to this proof of insurance rule. Other qualifying life events. You lost health insurance. Maybe you had employer-sponsored insurance and your employer no longer offers it, or you lost your job and therefore lost your health insurance coverage, or maybe you expect to lose coverage in the next 60 days. This would qualify you for a special enrollment period. There are a number of additional qualifying life events, and they fall into different categories that are a little bit more complex. You might have learned of these during COVID. If you could not sign up for a special enrollment period because of COVID, you then qualify for a whole new special enrollment period. Maybe you were displaced because of a hurricane and couldn't sign up for a special enrollment period. That also triggers something new. Or maybe you were hospitalized or otherwise incapacitated during the open enrollment period that just ended. Also qualifies you for a special enrollment period. There are a number of other events. You were determined ineligible for Medicaid. You previously even lived in a state that didn't expand Medicaid, and you became newly eligible for help paying for Marketplace insurance plan. You got an appeal decision that wasn't in your favor. There are all these new variations of what could have changed that allows you to go in and shop for insurance. And we have a full listing on the screen of some of those examples of some of those other things that happen, including changing status. Maybe you became a U.S. citizen or just left incarceration. These are qualifying life events. You can read more about what is considered a qualifying life event, and if there are little asterisks next to the rule, like that moving situation we talked about, on the healthcare.gov website. We give you the listing of special enrollment periods and where to go for help to sign up for these. Some of the navigators or agents you might have worked with in past open enrollment periods can also help with special enrollment periods. You can find these local assisters on the Find Local Help button on healthcare.gov. If you're here in Wisconsin, we have wiscovered.com that can get some local help closer to home.